Good morning. This is Mayor Joe Carfora with an important message regarding the COVID-19 public health emergency. As of yesterday, the town of East Haven currently has 53 identified cases and has 2 confirmed fatalities. Those numbers have increased about 27 from the middle of last week using East Haven, East Shore Health, and state data. As of yesterday, there were 5,675 laboratory confirmed cases in Connecticut with 189 deaths so far. Ages 50 to 59 are the largest group of those testing positive right now, but our seniors are overwhelmingly the most at risk. There is no one area of town that has more positives than the other. Our commitment to social distancing must be consistent and practiced everywhere. Make no mistake, this will be a challenging couple of weeks as we expect to see the number of cases to rise. Remain home if at all possible, unless shopping for food or in need of medicine or going to and from work if that is required. As difficult as it is, please keep children from congregating. On Saturday evening, I held a Zoom meeting with our police and fire chiefs, our town attorney, and the director of East Shore Health. During that meeting, we discussed, among other things, nursing homes and assisted living facilities, grocery store practices, and the use of masks. Residents of nursing homes and assisted living facilities are at risk. One facility in East Haven has been heavily impacted, and we are aware of that situation. Jurisdiction over these facilities lies solely with the Department of Public Health. The DPH and East Shore Health are heavily involved with that impacted facilities. Our job is to provide support to those entities when requested to do so, and we are. To date, we have provided limited amounts of PPE to senior facilities. Reports of those facilities are heavily controlled by the state, and there are strict guidelines that our town must adhere to. The town and East Shore Health District have received complaints regarding the practices of some grocery stores. During our Saturday meeting, we decided to team together an East Shore Health inspector with the fire marshal and a police officer to visit stores to make sure that they were adhering to the required food service orders and protocols. That will start this week. Regarding masks, the CDC is now advising the use of simple cloth face coverings to slow the spread of the virus. This will help people who have the virus and do not know it from transmitting it to others. Cloth face coverings made from household items or made at home from common materials can be used as an additional voluntary public health measure. The cloth face coverings recommended are not surgical masks or N95 respirators. Those are critical supplies that must be reserved for healthcare workers and other medical first responders, as recommended by current CDC guidance. We know that this virus is thought to spread mainly from person to person between people who are in close contact with another, through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly inhaled into their lungs. Social distance is imperative in preventing the spread of COVID-19. It means keeping space between yourself and other people outside of your home. To practice social or physical distancing, stay at least 6 feet from other people. Do not gather in groups. Do not allow kids to congregate in our parks. Stay out of crowded places and avoid mass gatherings. And if you are visiting from out of town, please quarantine for 14 days. Continue to wash your hands and practice routine cleaning of frequently touched surfaces like tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, sinks, and so on. If you think you have been exposed to COVID-19 and develop a fever and symptoms such as cough or difficulty breathing, call your healthcare provider for medical advice and they will direct you. Again, please don't fall prey to internet or telephone scams and never give anyone personal information. I urge you to be careful of social media locations that provide conflicting and divisive information. Some are passing information that is not accurate. Please refer to official sites for information. Incorrect information impacts our community, and it has the potential to place our first responders in harm's way. Late Friday evening, we finalized a housing agreement with the University of New Haven for the protection of our first responders. 20 beds have been reserved for our East Haven personnel, should that become necessary to protect them and their families. My office is working with social service groups, locally and regionally, and continuing to evaluate the best way to serve our community and its most vulnerable. We expect additional direction from the CDC, the Department of Public Health, and the governor this week. I, along with our emergency management team, will keep you updated. Check our website frequently for information at www.townofelasthavenconnecticut.org. We will continue to use the reverse 911 system when applicable. Please pass the word to sign up for these alerts at ctalert.gov. Thank you, and please keep our first responders and their families in your prayers. Joe Carfora.